And so the question now would remain to you, what would you like to do? Would you like to leave that infection running in the system, continually draining your system and your resources? Or would you like to try to start rebuilding your body, eating a higher quality food and a better diet to strengthen the system and now eject that tenet in your body that should not be there anymore? So again, this is all blood work. So let's say you have a child who's chronically sick. Blood work would be a good idea. Let's say you've been kind of feeling run down. Just been off for the last 6 months, year, 10 years, who knows? Yeah, blood work would be nice to do. And so, so who should get blood work? Let's say you feel awesome and you're an athlete. Well, do you know, or have you read, like I have read, about accounts of athletes dropping dead in the middle of a race? They're running a 10K or a marathon, and all of a sudden they drop dead of a heart attack. Had we done a couple of specific markers, we would have known if they were doing damage to the heart. And we could have been able to say, you know what? You can run that race, but you're running a huge risk. What do you mean I'm running a huge risk? I'm an athlete. I can run as long as I want. I don't get winded. What do you mean something's wrong with my heart? If you don't have enough natural whole foods that supply thousands of phytonutrients to those tissues, you're going to damage your heart just like anybody else. It doesn't matter how much you run. Great health is not made by exercising. I want you to hear that really, really clearly. If exercising was the end-all be-all, nobody in any race would ever die of cancer or heart disease or anything like that. Why don't you go talk to somebody like Lance Armstrong and ask him how that worked for him? So I want you to understand that when the body feels amazing, you have extra energy. And that's when I tell people you may start exercising now. When you have the energy to do so, when you feel there is a surplus of energy. If there is no surplus of energy, your body's saying, please don't do it. And so I'm very cautious with that. I've got clients that have heart attacks, and I do these specific heart enzymes that most medical doctors will not do. And when I do them, we find that, hey, you're outside of even their norms. They say 0 to 100 is good, but I tell them, I really want you under 40. I don't want you even close to 100. And they'll often come in the mid 100s. And that means they're tearing their heart tissue down specifically because this is an enzyme specific to heart muscle tissue, not just any muscle, the heart muscle only. And so if you're an athlete out there and you happen to hop on this talk, please, by all means, message me. I'll tell you what the enzyme is. Go get it done. It doesn't take a whole lot of money to go do it. And so protect yourself. It's something that you should be doing frequently just to make sure. And if it is elevated, I'm going to tell you what I tell my other clients. High vitamin C, high vitamin E naturally in your diet. Those are the things that begin to repair the heart muscle specifically. Yes, there are other things, but those are the biggies. Most athletes, their bane is getting enough natural vitamin C, not ascorbic acid, but natural vitamin C and natural vitamin E, not mixed tocopherols. Those are synthetic preservatives of the vitamin E complex. That is not vitamin E. So with that said, let's move on. So what blood tests do we do in the office? I do a CBC, of course, the complete blood count. We do want to see if you have infection, if you have chronic or acute infections going on in the body. The different types of white blood cells that may be high or low tell us where the infection might be, so it kind of gives us a pointing. And then as your symptoms come in, we can kind of corroborate all those things, say, yes, we have some digestive stress here. We really need to be working within the digestive system to begin to strengthen those tissues and allow your body to heal and kick out that infection. We also do a comprehensive metabolic panel. A lot of folks will come in and they'll have a basic metabolic panel. They skip the liver enzymes. They skip a lot of things in the basic that I really need to look at. So we do a comprehensive metabolic panel. There's a lot of things that aren't even in the comprehensive metabolic panel that I wish there was in there. They'll do calcium in that. They'll do potassium, sodium, chloride, but they won't do phosphorus. They won't do magnesium. They won't check these other minerals that I believe are quite important in giving us an overall picture of what are the major minerals doing in the human body. So important. Next, is we do a lipid panel. So we'd want to see what your cholesterol is, not because I would want to treat high cholesterol, but because high cholesterol tells me that, okay, you've got some stress in your life. You've got probably a food allergy, or you're doing something that your body's reacting to, or you're not producing enough hormones. And so your body's sending out more cholesterol, trying to make hormones, trying to repair. That's what cholesterol does. Cholesterol happens to also be, when the blood vessel cracks, it's the thing that fills in the cracks so it doesn't get washed away by the water in the blood. It's not the enemy. The enemy is vitamin C deficiencies. Okay? So we would look within that lipid panel at the more important cardiac factor, which is your triglyceride levels. We would also do an iron panel. We want to see how much iron and ferritin that you've got. Maybe you have way too much iron, and that's part of maybe your fatigue level. That also points in the direction of your liver's not performing well. And so we're going to go back to the comprehensive metabolic panel, look at your liver enzymes and see what's going on. I want to see a full thyroid hormone panel. I want to see the free stuff as well as the bound stuff. I just don't want to see TSH. TSH comes from the pituitary. It's not even a pituitary hormone, but that's often all they will do. And because the TSH is sending it down to the thyroid, if it's high, they think it's yelling at the thyroid and the thyroid isn't performing. But that's not necessarily the case. Often an underperforming liver is now to blame for a thyroid not doing well. And so I want to see all of that because I need to see who's doing what and how are your energy production pathways going. And then finally, there's some inflammatory markers that I definitely want to do, and they're usually single tests. We want to do things like a C-reactive protein, an LDH or lactic acid dehydrogenase. We want to see what is your GGT, another inflammatory marker. We also want to see let's get an idea of what your vitamin D levels are. And so we have this picture now that begins to take shape. Now that's basic stuff that I run each time a patient comes in because there's a lot of information that I need to see everything within the body. Then I have some clients that have hormonal issues, and so I'll run a separate specific hormone panel, male or female, depending on who. And sometimes there's cancer markers that we definitely want to run and see, are they out of norms? And so there's a couple specific cancer markers that are really sensitive to all cancers, or at least most. And so those are things that we'll see, like if we have somebody that is battling cancer and they're changing all these things and they want to do it holistically and they finally got it under control, we would know which marker that, hey, whenever they want to, you can rerun that marker anytime you want to. And it's $40 or $60 or whatever it is. And so if they kind of get freaked out over a weekend, they feel some weird things, they'll call up the office and say, hey, I want to run the cancer marker right now. Great, we'll have that ready for you in a couple hours. They'll come in, pick up the requisite, take it to the lab. I'll have results in 24 hours. I'll say, hey, you're fine. You're under 40. Everything's good. Okay, thank you. So this is kind of what blood can tell us. It can be quite relieving, and blood can be kind of freaky for people. I remember the first time I did blood, I'm like, what's it going to look like? What am I going to find out wrong? Even as good as my diet and things that I take care of, there's stuff I saw in my blood that I am working on. And so if some of you who know me say, man, I know your diet is pretty awesome most of the time. And yeah, it is, but I still live. It's not like I don't live. And there's not like I can't see in my past all the stuff and past deficiencies and things like that I've been through that I'm still working on today. It's just a process, and I'm okay with it. Do I feel mostly good most of the time and have tons of energy and I don't need 9 hours of sleep every night? I get 6.5 hours and I'm happy? Well, yeah. So my body performs really well, but I still see things that I wish to work on. Now you might feel great and realize, hey, my blood work's pretty good. I don't feel like I want to work on anything. Great, that's you. You could do a blood panel every year and just see how the numbers are going. And if you start seeing something creeping further and further away from normal, you can say, okay, I think I'm ready to work on something. So you may work on blood any way you wish. My job is to present it and say, this is what's possible. Now, here's the kicker. When we do blood work, we have a program that we run it through that literally prints out almost a paragraph on every single blood value that's out. It tells you what blood markers support it and what nutrition would we recommend that would help to balance it and to reinvigorate those tissues and get them to heal. Now, the great news is when I work one-on-one, I get to look at those things and now I get to ask a lot of questions because I know what those things are for. And now I can start pinpointing, do we have the right supplement Or do we need to fine tune it so it's something a little different that might actually help this blood value too? So there's some subtleties to blood work, but for the most part, we can actually talk about those things, and you can literally read up on them and say, hey, I think I want to do this one, and this one for sure, man. Those are things I want to work on. Great. Let's recheck you in a couple months, those blood markers that were positive, and see how your body's performing. Now you get to have a report card and you get to see, are you actually making improvement, which is awesome. And so that's blood work. Now, let's say that we also throw in a hair test and a urine test with that. Now we get even more information in that report that literally tells you what's going on. And the even better part that I love reading about is that people that are on 3, 4, 5 medications, we list those in there and it tells what the medication does, what deficiencies it causes, and what would we do about that? And so ultimately our goal is not to get you off medication. That's not our goal. Our goal is to make those medications obsolete so that you don't need them. You can go back to your medical doctor and say, I think I'm good here. And now they can take you off of them because you are good. So that's blood work kind of in a nutshell. 2 weeks from now, I'm going to be doing a talk on allergies. Here it is, the end of April, and everybody's starting to have all the tree pollen and all that stuff. We're going to go through allergies, things that you can do, things to know about why the body is allergic. How do we begin to respond and help that body, and real things you can do even right now that help with allergies and getting over them. So that's in 2 weeks on May 13th at 6:30 p.m. Join us right here on Facebook Live. Can't wait till then. And until that time, I'm Dr. Troy Munson on Infinity Whole Health.